Greetings. This message is in response to a comment from one of our subscribers, Hooter A62. That's HOOTA 62. It says, "Hello, Professor. Regarding job opportunities, kindly give advice on what better exam, uh, which is better, I'm assuming, blood bank or general MLT." So this is a very good question to ask. Which exam would give you the best perspective and the best outlook based on what you as an individual desire to pursue for this season or for the season that is to come? So you have to know yourself and know if you want to be in this profession of medical technology or clinical laboratory scientist as a long term play, or you're just here for a seasonal excitement or a seasonal benefit. So, if you're just here for a seasonal benefit, then the route to take would be a specific department in which you have competencies or you have a natural affinity. But if you're playing it in the long term game, the best mode of approach is to be a generalist in which you have more flexibility in being able to navigate and to be able to practice in different areas where the licensure is required. There are many areas in which you can, or states that you can practice, and licensure is not really a big concern if you are not an international person or if you are a native of the United States. You can practice without licensure in certain states. You can have a non-medical laboratory science degree and practice in a lab being trained by a medical technologist. So it all depends on where you fall on that paradigm. So the first thing that I want you to think about is what is the purpose and the intent of you being in this profession? Is it that you want to use this profession as a stepping stone? Uh, or do you want to use this profession as an end all be all, which means that this is the profession that you want to spend the next 20, 30 years of your life investing in? If that is the case, it would be advisable to become a generalist before you move into a specialized area of focus. Because with the generalist, you can operate in blood banking, you can operate in chemistry, you can operate in hematology, you can operate in microbiology, you can operate in different immunochemistry and different PCR establishment. So you have more flexibility. But if you have your mind just set on transfusion medicine and you just want to do blood banking exclusively because you don't want to be called upon to engage in any practice outside of what your inclination or your heart's desire is towards, then you can go with the route of being specific. You may have this question, but others may also have the same question. So we're just gonna put it out there so that others can have an appreciation for the question which you have indicated to us, so that they can be uh, beneficiaries of the response. As it relates to medical technologists, this profession is one that has the potential to provide a reasonable income if you want to just have a average or a normal life. If you want to enjoy the vastness that life has to offer, just being a medical technologist is not going to be the end all be all. And we need to also remember that as a medical technologist, you are not necessarily restricted to just being in the lab on the bench, because most times people think about being a medical technologist just being in the lab, being on the bench, doing laboratory work. But the scope of practice for a medical technologist is far reaching beyond that. You have medical technologists in research, even though there are few who are in research, because most medical technologists are persons who tend to be introverted in most of their interaction. They have not the greatest affinity towards entertaining or interacting with patients. So that is why they have chosen the path of medical technologists. Uh, Most medical technologists, they have a tendency to like to be in seclusion. They like their peace of mind. They like to be focused on their general thought process, and they are more systematic in their operation. So that is the general behavior of medical technologists. These are the general character attributes that most medical technologists have. Not all, because you have those anomalies, those outliers that exist. So you have to just know where you fall on that spectrum, and then based on your desires, what you see for yourself in the future, then you can make a decision, an informed decision, as to if this profession is the best option for you, and if you want to operate in it long term, or you just want to operate in it short term. And if you just want to do a long term situation, then a generalist licensure would be most ideal. If you just want to do short term, then you can choose to do a specialized area of medical technologies, biology, whatever it is. But let me present to you. If you went to school to study medical laboratory technologies, medical laboratory science, to become a clinical laboratory scientist, it would be most beneficial, after investing that amount of time, that amount of energy, to become a generalist. In that, you would have been able to float in any department. That would give a true reflection of the intricacies of your study. The specific areas were basically designed for persons who do not necessarily have their medical laboratory science degree, and they wanted to just operate in a specific area because they're using the medical laboratory science as a stepping stone into moving into the next profession, or climbing the ladder. All right. So, like if a person have biology, they can do the microbiology specialty, so that they can work in the microbiology portion of the laboratory. So this was a way to allow other persons who were not fully qualified to be able to gain competency and operate in the laboratory. So if you are fully qualified, you have the knowledge, you have the prerequisite skill set to actually go in and do the full gamut of the examination. And you realize that in the long run, it would work out better because it's one less thing to think about in the future. If your mind change, if you have challenges with a superior or supervisor, whoever it may be, and you want to shift in dynamics, or if you're going to go work for a manufacturer, and they require that you have some expertise in certain areas, or you have studies in certain areas, you have this certification to show that, hey, I'm a generalist, I have experience in all areas that concerns medical technology, clinical laboratory science, laboratory medicine as a whole. So I hope that this was informative and this gave you some perspective as to which is better, to be a generalist, medical laboratory technologist, medical laboratory scientist, or to be a specialist in terms of selecting a specific certification when you're just starting your profession. I'm not speaking about being a specialist when you're advancing and you're specializing in immunohematology after you are a generalist. All right. So we want to think about it from a medical perspective. When a doctor is studying medicine, they study all different areas of medicine and then they specialize with their residency program. It's the same principle that takes place. A doctor, after graduating, they are basically a generalist, and then when they're going into residency, they specialize in the area where they have the best odds of success. So that is the kind of mindset I want you to have as you navigate through this career decision that you're going to make. I wish you all the best, and it is a hope that you will choose to be a generalist, and then if you so desire to like the profession, then you can move into specializing. But if you just want a quick fix, then go for the route of just selecting the specific department that you have an opportunity to work in to get that qualification, and then you move on with your life as you see fitting. So it all depends on you and what you think is in your best interest based on the time you have, based on the resources that you have. But why would you want to do one exam two times? So that is up to you to decide. I pray for you and wish you all the best on your examination and your prospects as you seek employment.